Well, hello, everyone, and thank you for attending our COVID-19 webinar follow-up series. My name is Holly Foxworth. I'm a registered nurse here at Axiom Medical, and I'm also joined by, it's going to be Dara. She'll be here momentarily, but Dara Wheeler, who is our Chief Marketing Officer. And then we also have this week Dustin, that is Dustin Mathews he's the hospitality expert, but then also sales manager at the Margaritaville Resort, Lake Conroe. So it's always thrilling to have new faces that are here on the live stream, and I appreciate you joining us, Dustin.
Absolutely. Thanks for having me.
You bet. Before we get started in this, and while we're still maybe waiting on Dara, let me go ahead and have you introduce yourself, maybe give us a quick history of your background, and then we'll get started.
Sure, absolutely. So, I appreciate you having me out here again this week. So like was mentioned, I'm Dustin Mathews. I'm a National Sales Manager at Margaritaville Lake Resort, Lake Conroe, that just opened up this summer on June 26th. I've been in the industry for about 20 years now with all kinds of various roles, and it's great being on the sales side and really learning your customer needs and executing them through the finish. So I appreciate being here, and I look forward to answering some of these follow-up questions and hopefully giving you some good insight and comfort for this holiday season.
Definitely. Perfect. Well, obviously, as we see that Thanksgiving is quickly approaching, and then obviously we'll have Christmas that follows quickly behind that as well. It's like you can feel these levels of anxiety that are just continuing to rise each day, it seems like, as we approach that. You turn on the news, all of a sudden you're seeing all the headlines of all of these cases that we're having, et cetera. And so especially understanding the science behind transmission of this virus, then, it's pretty obvious that will have a continued increase in cases that will come with this. But as we've talked about here, we spoke about in the webinar this last week, one of the most important things that we can do, obviously, is to educate. And so we've really pushed for employers to kind of put on that public health education hat and start having these conversations with their employees, communicating, making sure that they understand what some of the dangers are that are associated with this, that they know what their individual risk level is, and so they can make some of these responsible decisions moving forward. And then the back piece of that is having a plan, knowing what it is that you're going to do as people are off traveling, but then they come back. How is it that you're going to be able to assess for those that have symptoms, those that may be asymptomatic that then come into the workplace and expose others and cause some of these outbreaks? So I think it's great to have these discussions right now before we get there, so we can kind of get our ducks in a row and have some plans moving on. And then, Dustin, the other thing I was going to say, too, was that you shared some really great information this last week about the hospitality and travel industry as well. I mean, some of those best practices that you had shared with us. It's so important to be able to know that in advance so that we can identify what some of these red flags are and say, hey, they're not practicing what they preach at this facility. Maybe we need to make some other decisions, et cetera. Yeah. So great job with that. And then there was one thing that I wanted to share also, Jason, maybe if you can pull it up as we're talking about it. But I ran across this COVID-19 event risk assessment planning tool this week. And so it really kind of answers some of those questions. Like if you're traveling to a specific area, you have some concerns, you can actually pull up that area by state and then also county and enter how many people that you will have at your event. So, add that event size, and then it will actually give you a projected risk level that would be associated based on the number of cases that are in that area and the community spread. So if you guys want to take a look at that, the website there is listed right there at the bottom. So you're welcome to take a closer look if you're interested. But we'll go ahead and move on with some of these questions while we're waiting for Dara to join us. Dustin, let's see. Let me jump into this because I think we're going to go to Dara first, but let's go ahead and move on to the next one, which was from Melissa. And so Melissa was wanting to know, are you aware of any policies that hotels or resorts would have in relation to people developing symptoms that would be associated with COVID-19, and would they be required to provide your facility with notification of that?
Absolutely. So thank you, Melissa, for this question. And I'll try not to be too long-winded on this one. So I'm going to start with the latter portion of this first. So in the United States, where guests are not required to notify the facility that they're staying at should they develop any symptoms. While some properties will have health and temperature checks to help monitor this, not all will. We hope that if someone is feeling symptomatic, they will get tested and then alert the facility, but it really is up to them. Now, there are a number of hotel policies in place. All hotels are going to have, the things social distancing, PPE requirements, strong safety policies, et cetera. That's across the board. We all know that. But the big difference with this specific question is going to be if the guests develop symptoms in a state with or without the mandatory travel quarantine. So even before the guest arrives, one thing closely monitored everywhere is length of stay and stay extensions once on site. In states with the mandate, lengthy reservations and guests that greatly exceed their stay will be automatically watched to see if the guest ever leaves the room or not. Should it appear that a guest is or begins self-quarantine or becomes symptomatic, this will be reported to the health department, and heightened security around the room will be in place for guests and staff. This will include continual monitoring, restricted access to the room, not placing other guests in proximity, and employee education. Employees that interacted with the guest will be tested. Most states with the mandate have the right to refuse service policy, but there are also homestead acts that extend a hotel room, making it difficult to remove a guest from a facility. If a guest develops symptoms and attempts to extend their stay, the facility may not allow them to do so, or might raise the room rate to the highest possible, which is posted on the back of your hotel room door. All hotel services will likely be refused, and again, the guests will be reported to the health department. Now, the flip side, in states with the quarantine requirement, all guests are really in the same boat, right? Symptomatic or not. Most states have the health training policies to become a certified facility and housing quarantine guests, and likely have policies to enforce the quarantine. So this can include having a single-use room key. So if you leave the room, you have to get a new one, allowing the facility to know that you broke the quarantine. But most will also have things like defined schedules for guests to be able to go outside or walk around the property in safety, and ensuring the guests have long-term supplies of linen, toiletry, and other items provided by the facility. So really, there's those two big differences.
Wow. Okay. And so whenever you brought this up this last week, hey, Dara, thanks for joining us. And you brought this up last week when we were going through this. But so in terms of limiting exposure to those areas, are you saying then that like the housekeeping staff, they would only come in, they wouldn't be coming into the room and therefore have as much interaction with the guest?
Yes, absolutely. And that's going to be across the board, regardless of the state you're in. Just minimizing any guest exposure or, person-to-person contact is just so key and so important right now. So that's why you see reduced occupancies and the social distancing everywhere, and, not entering people's guest rooms like for housekeeping services.
Great. Okay, perfect. Let's see, Dara, let's go back up to the first question that was asked. Let's see, what did we have? We had, I know what it was. It was about the on-site testing. Obviously, we've had a lot of questions that continue to roll in terms of what some options would be there for testing, especially following the holidays. But Scott was asking if employees return from Thanksgiving travel on Sunday, when should they have them tested? He was asking, should it be like a 72 hours after their return? Do you have anything to add to that?
Yeah, that's a great question. It really depends on a protocol that you should put into place now, if that's something that you're interested in doing. If you're using PCR testing, the rule of thumb is that you're typically going to catch an infection about 5 days after exposure with a PCR test. So if employees are returning from Thanksgiving, you need to really think about putting other layers in place. Check into work, an app like Check into Work, and doing a daily health attestation. If employees are symptomatic or people are symptomatic, you're going to catch a big proportion of the people that may be infectious. But often you're not going to necessarily find out if they're positive until day 5 through day 10. So you need to think about those types of protocols as people are returning. And definitely encourage employees and your teams to maintain hygiene levels and personal protective equipment, make sure they're wearing their masks, remaining as socially distant as possible, although socially distant, let's say physically distant. So I've seen a lot of information lately. A lot of states are locking down. I was just speaking to one of the risk insurance groups in Colorado, and Colorado just recently today has announced that they've reduced all occupancy down to 10%. So starting tomorrow. So there's states that are starting to lock down because of hospitalization levels. So be paying attention very closely to your state and legislation. And then also just create a good plan and enforce it. So try to do as much as you can now before everybody's returning and you're trying to scramble to figure out what to do.
Absolutely. Good information. Allie had actually asked us about what it is that travelers, if they're going to be traveling for the Thanksgiving holidays, what is it should they be bringing with them? So she was asking maybe should they bring disinfectant wipes, Lysol, what type of products would you recommend that they travel with? Neither one of you are welcome to answer that.
Sure. So one thing I wanted to point out first is the CDC's also recommended getting a flu shot before making your travels this season. It's a good idea to pack your extra supplies like masks and hand sanitizer, disinfectant wipes, gloves, medicines. You are now allowed to fly with hand sanitizer over 12 hours, so you can get through 12 ounces, excuse me, so you can get through airport security with that now. But then if you're having a quarantine, think about all your daily things. Any activities, books, reading glasses, anything kind of day to day that you would need to stay comfortable.
Good.
Yeah, I agree. I do think that having wipes, I've seen, especially when traveling, I've got a young child. She is 1.5 and everything goes in her mouth. So when we have traveled with her, we do try to wipe as much as we can down in the vicinity. And she still gets sick. So it's very difficult. So if you're traveling with young children, you need to be very, very aware of how you're traveling, what you're traveling with, how to disinfect your immediate space as you travel, and that hand sanitizer. I mean, I never thought I'd be a germaphobe, but here we are. So you've got to have it on you at all times. And, luckily the older kids are kind of still, there's still some novelty with it. So there's still some fun with the hand sanitizing, but yeah, it's definitely stuff you should be traveling with. So I definitely agree on wipes and sanitizing and the flu shot, great tip. I'm definitely getting everybody prepared to reduce the risk of any disease at this time.
Yeah. And, something I was reading the other day that they were talking about, we have kind of this false sense of security sometimes of that at the places we're staying. Yes, while the rooms are clean, some of those really frequently touched items like the remote control, the phone, the door handles, et cetera, those are places that you may want to go ahead and just do another once over, make for sure.
Yeah, and I've seen some of those other technologies coming out, like the different infrared technologies that can get rid of germs, and there's a lot I'm sure that is going to continue to be developed and coming out over time, and it'll be a whole new market that we're all really excited and interested in moving forward.
For sure, absolutely. The next one, I really like the question that came from Paul because he was asking if you're traveling to another state that has a 14-day quarantine requirement, can that be done at like a relative's home, or do they actually have to stay in a hotel? And the backside of that question was who would actually be monitoring some of these isolation requirements. So I'm sure he's asking who's going to really watch and make for sure that some of those rules are covered.
I'll start and then pass it over to you, Dustin. So I think it's going to be very dependent upon which state you're talking about, which county. There are a lot of regulations and rules depending upon where you're going. We've had employees that are critical infrastructure employees travel to other states that require quarantine. And these are nurses that are traveling and they still required them to do a mandatory 14-day quarantine. And what they did was as they entered into the state, they had to document upon entry where they were going to be staying, which hotel, and they were checking up on them. So there were people checking up to make sure, and their fines can be levied at that point. But of course, that's corporate travel that we were moving to another state. Now, for personal travel, that's a great question. In terms of who's monitoring that, I think they're documenting, again, who's coming into the state and where they're staying. And I do think that there's what I've seen is that it has been not quite to the full level of where we were with mandatory quarantines. It's been more heavily encouraged quarantines. So how they regulate that will be interesting.
For sure. Dustin, did you have anything you wanted to add to that?
Yeah, I did. Cause there were a lot of good points that you made because every state is so different. And as we discussed, like with Colorado, having stronger crackdowns tomorrow, you really, even if you looked at this a couple of days ago, still keep up with it to know before you go. And there are a lot of the states, not all states have the travel restrictions, and the ones that do, some of them are recommendations or things that they would like everyone to be subject to, but some of them are hard enforced and pretty pretty costly. To be isolated for 14 days is a big a big undertaking just to go on a vacation. So do look though, because sometimes there are some outs if you have some positive test results before you go, and just really look at all the different little details that could surprise you. So I did want to talk about one thing about if there's a relative, if you stay at a relative's house, this really comes down to physical separation. And a lot of the homes, if you stay with relatives and then you're with other people, then everyone in the residence is going to have to be, doing the 14-day quarantine. So if there's, garage apartments or an outside accessible basement or something like that, then you feel good to go for it. But if it's truly in the house with other family members, then the whole household's going to have to quarantine. So and then lastly, there are some interesting ways that people are monitoring. So in the lockdown cities, if you break your quarantine, the resort or the facility will be the ones to report you to the health department. And then airlines are you're sending out your travel requests to the states, and a lot of the states require you to fill things out online if you're driving. So it's a really documented process, and there's a lot of different hands into the monitoring process of it.
For sure.
Yeah, really great points. I was going to mention the test out option and some of the others too. That's a great point. So very good reminders.
And that came up last night. I was watching something about it where they were talking about, are we really giving ourselves kind of this false sense of security? It seems like that's been kind of the trend, or that's where it's looking, is people feeling that if they went ahead and had a test performed and it was negative, then that shouldn't interrupt any of their family plans that they have going on. But obviously there could be some changes there. Just because you get a negative test does not mean that you in fact are negative for the virus. Yeah. Okay, let's see. What else did we have? We had, Dara, let's see. I'll come to you for Tiffany's. Tiffany was asking if somebody is exposed, but they have not developed symptoms yet, can they still spread the virus?
Yeah, unfortunately, what we've seen is the incubation period for COVID is one of the issues. It's about a 14-day incubation period, and you may never develop symptoms and still be infectious. So we've seen all the news stories about the super spreaders and the people that don't know. I think there was a wedding that has been used now for people, the warning for people to traveling around this time. It's really difficult. I think there's ways, like we said, there's layers. You should always think of the different layers. Think about the hygiene layer, the symptom layer, the exposure layer. Just pay attention to all of the different layers. And if you've been a confirmed close exposure, you need to really give it the time. And you can test. And like I said, you want to start testing about day 5 to 10 to see if you are positive. But in the meantime, you need to isolate and make sure you're not spreading.
Mm-hmm. For sure. All right, let's see. The final question that we had came from Rachel, and you both may want to add some comment here. But anyway, she was asking if she's going to fly, should she wear a face shield?
I was just talking about this because I'm tentatively flying somewhere at Christmas, and I probably will make my 8-year-old wear a face shield, but it should be with a mask still. Dr. Cherry, our chief medical officer, always says, you still need to wear a mask first. A face shield is a good secondary layer, and it is good because it covers eyes and some other areas of the face that may not be covered by the mask here, but it should always be in conjunction with that mask.
Yeah. Dustin, anything you wanted to add to that?
Yeah, absolutely. Have the mask on, and I think it's figure out what you're going to be comfortable with, because you're going to be on a flight for a while, right? So don't put yourself in a situation where you're not going to feel safe. But also, look at how qualified your airline is in terms of how they're ranking in their safety and in their precautions. If it's a packed flight with not the best cleaning and sanitation records, then that should be taken in consideration, and as opposed to a lower occupancy flight with very high regards for safety. So I think that it's good to look at that. But one thing that I did want to point out, which I thought was kind of interesting for the travel industry, is Emirates and Virgin Atlantic are now doing COVID-19 insurance to passengers with their flights, covering medical expenses and quarantine expenses and things to just really try to get people to, to get back out there. So I thought that was an interesting move for them.
Yeah,
That's great.
I haven't heard that. Yeah. So how would that work? I mean, that covers in the event that they were exposed and they contracted the virus, or what? How does that?
Yeah, so you have to be tested prior, to confirm, or you do test to have a negative result, and then once you take your flight, you're covered for 31 days, and it's built into the cost of the ticket. It's not something you sign up for, and then if you do have medical expenses or any kind of costs associated with it, there's Virgin has up to $650,000 on the policy, and Emirates has $174,000 up to on the policy. So it can include, your quarantine, living expenses, hospitalization, everything involved with it.
Huh. I had not heard of that before. Dara, were you aware of that? Have you heard about that?
Yeah, I hadn't heard. That's great. Great information.
For sure. Yeah. All right. Well, I think that wraps up the majority of the questions that we had here. Anything that you guys wanted to share, kind of closing remarks before we wrap up?
I would just say keep looking at your state or the state you're going to travel to's Department of Health website. Everything's changing so quickly and so rapid. Just pay attention and just do your research and trust your gut.
Yeah, I agree. Just pay attention, read the resources that you've got, try to weed through the noise a bit and make some good decisions, because like we said, risk is there no matter what, but it's making well-educated decisions and trying to at least weigh the risks that are okay for you.
Agreed completely. Well, thank you both for joining us here. Just a few quick mentions before we go. I did want to bring up that obviously next week is Thanksgiving, so we will not have a webinar then, but we will pick up the following Thursday, which will be December the 3rd at 1:00 p.m. Central. That is going to be vaccines and therapeutics, expectations versus reality. So Dr. Scott Cherry, our Chief Medical Officer, will be joining us for that. If you haven't already, make sure that you sign up. There's going to be some great information that's there. Of course, you can submit your questions to us in advance using the coronavirus at axiomllc.com email address. Last thing I wanted to mention was we do have a new white paper that's addressing some of the strategies that will be associated with managing the flu during the pandemic. I think you brought that up earlier, Dustin, of pointing out that some of these flu shots, that's really, really where we need to put our focus and put a lot of effort towards. So this is an issue that employers are addressing this season. They're dreading it. We understand, but this will give you some good ideas on how it is that you can effectively manage that. So if you want to download a free copy of that, you can do it from our website. As always, should you have any questions about checking the work or checking the school, we're happy to answer those. Thank you again for joining. We hope you have a happy Thanksgiving, and we will see you December the 3rd. Stay safe.